Delirium is an acute, often sudden change in mental state, characterized by confusion, disorganized thinking, reduced awareness of the environment, and impaired attention. It is a serious condition that usually indicates an underlying medical issue and often fluctuates in intensity throughout the day. Delirium is common in hospitalized or elderly patients, especially those in intensive care units (ICUs). Types of delirium. There are three main types of delirium. Hyperactive delirium, characterized by restlessness, agitation, rapid speech, mood swings, and sometimes hallucinations or delusions. Hypoactive delirium, often more subtle, marked by lethargy, inattention, reduced movement, apathy, and confusion. It can be mistaken for depression or fatigue. Mixed delirium, a combination of hyperactive and hypoactive symptoms, with the person alternating between the two states. Causes of delirium. Delirium is not a disease in itself but a symptom of an underlying problem. Common causes include infections, urinary tract infections, UTIs, pneumonia, sepsis, or other systemic infections are frequent causes, especially in the elderly. Medications. Certain medications, e.g., opioids, benzodiazepines, anticholinergics, and some antibiotics can trigger delirium, particularly in older adults. Substance withdrawal. Withdrawal from alcohol, sedatives, or narcotics can lead to delirium tremens, a severe and potentially life-threatening form of delirium. Dehydration or malnutrition. Lack of fluids or key nutrients, especially in elderly or frail individuals, can cause delirium. Metabolic imbalances. Conditions such as hypoglycemia, low blood sugar, hypercalcemia, high calcium levels, or thyroid dysfunction can lead to delirium. Organ dysfunction. Kidney failure, liver failure, or other systemic diseases can disrupt the body's internal environment, leading to confusion and delirium. Surgery or anesthesia. Postoperative delirium is common in older adults, especially after major surgeries like hip replacements or heart surgery, likely due to anesthesia, pain medications, and the physical stress of surgery. Brain injuries or disorders. Stroke, traumatic brain injury, or pre-existing conditions like dementia increase the risk of delirium. Sleep deprivation. Prolonged lack of sleep, particularly in hospital settings, can contribute to cognitive disturbances. Symptoms of delirium. Symptoms of delirium can vary widely and may fluctuate throughout the day. Common symptoms include confusion and disorientation, difficulty focusing or paying attention, rapid mood swings or emotional outbursts, hallucinations, seeing or hearing things that aren't there, or delusions, false beliefs, rambling or incoherent speech, restlessness, agitation, or lethargy depending on the type of delirium. Changes in sleep patterns, including daytime sleepiness or trouble sleeping at night. Memory problems, particularly short-term memory loss. Altered perception of time or surroundings. Difficulty with logical thinking or following conversations. Risk factors for delirium. Certain factors increase the risk of developing delirium, especially in older adults. Age. Older adults, particularly those over 65, are more prone to delirium. Pre-existing dementia or cognitive impairment. Hospitalization, particularly in ICUs or following surgery. Chronic illness or multiple health problems. Polypharmacy, taking multiple medications. Alcoholism or substance use disorder. Visual or hearing impairment. Diagnosis of delirium. Delirium is a clinical diagnosis based on symptoms, medical history, and physical examination. No single test can diagnose delirium, but certain evaluations help identify the underlying cause. Physical examination. Healthcare provider will assess vital signs, neurological function, and look for signs of infection, dehydration, or other medical conditions. Cognitive tests. Simple assessments, like the Confusion Assessment Method CAM or Mini Mental State Examination MMSE, can be used to test the patient's attention, memory, and orientation. Blood tests. Blood work can detect electrolyte imbalances, infections, metabolic issues, or organ dysfunction that may contribute to delirium. Imaging tests. CT scans or MRIs may be used to rule out strokes, brain injuries, or other structural causes of delirium, especially in cases of new or unexplained symptoms. Urine analysis. To detect urinary tract infections or other problems that might lead to delirium. Electroencephalogram EEG. In some cases, an EEG may be used to detect abnormal brain activity, especially if seizures are suspected as the cause. Treatment of delirium. Treatment focuses on addressing the underlying cause of delirium, managing symptoms, and providing supportive care to ensure patient safety. Treating the cause. If delirium is due to an infection, dehydration, or metabolic imbalance, treating the underlying condition, e.g., antibiotics for infections, IV fluids for dehydration, often resolves delirium. Medication management. Review and adjust any medications that may be contributing to delirium, particularly in older adults who may be sensitive to certain drugs. In some cases, antipsychotic medications, e.g., haloperidol or quetiapine, may be used for short-term control of severe agitation or hallucinations, but these are used cautiously due to potential side effects. Environmental modifications. Providing a calm, well-lit environment can help reduce confusion and agitation. Family presence, familiar objects, and frequent reorientation, reminding the patient where they are, the time, and the date, can be helpful. Minimizing sensory impairments by ensuring patients have their glasses or hearing aids can improve awareness. Hydration and nutrition. Ensuring adequate fluid and nutrient intake can help reverse delirium, especially in elderly or frail patients. Promoting sleep. Encourage normal sleep patterns by reducing noise at night, limiting naps, and promoting relaxation techniques. Safety measures. Delirious patients may be at risk of falling or self-harm. Providing supervision, possibly with the assistance of trained staff or family, can ensure their safety. Prevention of delirium in high-risk individuals, particularly older adults or those undergoing surgery. Several strategies can reduce the risk of delirium. Regular hydration and nutrition. Ensure adequate intake of fluids and proper nutrition, especially during illness or hospital stays. Medications. Minimize the use of medications that may contribute to delirium, particularly sedatives, anticholinergics, or opioids. Cognitive engagement. Encourage activities that engage the mind, such as conversation, reading, or simple puzzles, to prevent cognitive decline during hospitalization. Environmental adjustments. Providing a familiar, calm, and well-lit environment can help prevent disorientation. Sleep hygiene. Help patients maintain regular sleep-wake cycles by promoting relaxation, minimizing nighttime disturbances, and avoiding unnecessary wakefulness during the night. Early mobility. Encouraging early movement and physical activity, particularly after surgery or hospitalization, can help prevent delirium by maintaining physical and cognitive function. Prognosis. The prognosis of delirium depends on its cause, severity, and how quickly it is treated. Acute delirium may resolve within a few days or weeks once the underlying cause is addressed, but some people, particularly the elderly, may experience lingering effects. In people with pre-existing conditions such as dementia, delirium may accelerate cognitive decline and increase the risk of long-term disability. Delirium can increase the risk of complications, such as falls, infections, and prolonged hospital stays, especially in older adults. Conclusion. Delirium is a serious, often reversible condition that requires prompt identification and treatment. It frequently indicates an underlying medical problem, making early recognition and intervention critical to prevent complications and improve outcomes. Ensuring supportive care, correcting the cause, and implementing preventive strategies can help manage delirium and minimize its long-term impact.